Jay, you should ask Mr. Picente the same question you ended with on Mr. Brindisi there.
Yeah, I asked Anthony, and I'm not sure if you heard that on hold, but the question at the end of the day, did you feel slighted that the money was removed from the budget and now we have to go back to Albany and fight a little bit, if you will?
Well, no, I mean, I didn't feel slighted. I guess I would have felt slighted if we left there without the commitment afterwards. Then it would have been a different story. Obviously, we were surprised. I mean, but these are things we have to deal with, and it's also things that people pay us to deal with, and elect us to deal with. So, at that point, no, I didn't feel slighted. It was something I felt comfortable that we would work out. I had no real indication otherwise. I'd spoke to the governor over the weekend, and he said we'll fix this, and I had no reason to doubt that, and I didn't. And so yesterday was really a matter of really explaining to a greater group and some other members of the governor's staff and the health department and others to really outline where we've been and where we're going and why the need is so important.
Was there a misunderstanding? Is that the way that they explained it to you yesterday?
I think it's it goes back to the $150 billion budget that things get moved around, and there was a misunderstanding somewhere. I'm not really sure where. I think we started the meeting that okay, we know this happened. Let's move forward. So we really didn't spend any valuable or any time on what happened or why, other than let us tell you where we are and why this is so important and what we've done to date and what's been done and where we want to go and why the state's commitment is essential and crucial, because I think we made it clear that anything less than the $300 million commitment from the state would not get this done, because it's a large project that is going to be twice that amount at least, and has other pieces to go along with it. So I think that was the commitment that this is a project that clearly we're invested in, the governor's invested in and believes in, and his staff understands, and so we go from here.
And we talk about this commitment. How concrete do we feel that a commitment is, and where do we go to make that bring that to more of a fruition than just holding on the contingency of someone's word?
That's what we do each and every day. I mean, it's a matter of obviously actions, are what everybody wants to see, and everybody wants to see the line item and such. But you still need a commitment. You still need the understanding. You still need the belief in a project. It's not just about putting numbers in a budget. While as important as those are, there has to be thought, design, and really built a plan behind it. And so those were things that we showed that perhaps there was a disconnect, or there was a disconnect somewhere in the chain of command in terms of that, not seeing all that had been done and why this was so important. So, but the commitment is there. It's don't make us leave there with go back to and work on this, because the hospital system, MVHS, has spent nearly $500,000 on just different consultants and early design and reviews and other pieces to look at this. So that's the commitment is solid, and we'll see in the next 30 days what gets put into the budget for this year. As the Assemblyman said, this is going to be a multi-year project. We knew that, and the amount that goes in can be, if it's spread out, then we'll deal with it, because you're not going to spend $300 million a year the same way we didn't spend $300 million or even dent it in the 9 months, because there's a lot of work that has to go into this plan. So I'm still comfortable with the commitment. I have no reason to believe otherwise. And as the days go on, we just have to continue to stay on top of it as we have been. And,
what is the commitment? What is the
look,
commitment?
What is the commitment?
Yeah,
the commitment is the support and the commitment to see this plan through with the understanding that anything less than $300 million from the state doesn't get it done. So, I mean, that's the commitment, and how that gets spread out and allocated is something that obviously the assemblyman, the senator will be monitoring very closely because they're there, every day pretty much during this budget process and this legislative process. So
the commitment to the project is there. So now the further talk is the monetary part of.
You can't send us, and that was the point. We weren't, you can't send us back home saying, well, we'll think about it, or we don't know, or it's whatever. It's like, no, we're committed to it. Committed to getting this done. Understand it. The need for a new healthcare system or a new building, new facility in Oneida County in Utica, and we've done all the other pieces that have gone along with this to get to this point. The consolidation of the hospital systems, I think, is why this money showed up in the first place. Is the really a major reason for this. For this looking at this new facility because the merger that took place and continues to grow. So now it's about getting a healthcare system in place, a facility that is efficient and can deliver, a better system, a more efficient system, a more controlled system in terms of all of the aspects that a new state-of-the-art hospital will grant them.
All right, looking forward to that. Also, other big news out of the Oneida County Attorney's Office under your auspices, the creation of 3 new jobs, something that had to pass muster through you in terms of the necessity for those positions, correct?
Yeah, correct. I mean, we have operated, county government in the past and, prior to as county executive and my time there before, but also in time, the attorneys are tough to get a hold of, especially on the municipal end. We have great attorneys in whether it's in social services, dealing with family court, and then, of course, goes without saying, the district attorney's office, the public defenders. But in the county attorney's office, we have relied a lot over time on part-time attorneys because of the nature and the workload. But the workload is changing, and so we need to change. And with the demands from the state and federal government on the various contracts that we have to process, there's literally over 2,000 contracts that go through that office in a period of time, in a year's time, that either are renewed or new or different, that have to be through whether it's not-for-profit agencies or other state agencies or federal agencies and requirements. And so the burden is something that County Attorney Pete Rahill has been dealing with, and so he's looked at a plan that can move these pieces quicker, which we need to do. We need to improve the process of passing contracts, of obtaining grant funding, and likewise paying our vendors at the same time. We have numerous capital projects that are underway, so there's a lot of work there, but this is an efficient way of doing it by getting away from part-time and putting full-time attorneys in that office.
All right,
and give some young and some new lawyers some opportunity.
Thanks for joining us, Anthony.
No problem. Always a pleasure, guys.